Hello, welcome to this episode of Let's Talk Death. I'm Fran Solomon.
And I'm Andy McNeil.
And we are thrilled to be your hosts for these conversations. Let's Talk Death is brought to you by Heal Grief, a social support network creating community after someone has died. Everything we do is inspired by our core belief that no one should ever grieve alone.
Our goal with this program is to have a friendly chat with some amazing people so we can help normalize and educate our Heal Grief community. Our guest today is Dr. Jeff Spiess. Dr. Spiess has spent his medical career with people facing serious illness and death, first as an oncologist, then as a hospice physician. He has lectured extensively and has been recognized as a leader in the field of end-of-life care. He has observed through extensive clinical experience and innumerable conversations with the dying and those caring for and about them, the burden of unnecessary or unavoidable suffering and distress engendered by the American tendency to avoid facing death as an inevitable personal reality. His writing provides information and inspiration, challenging readers to honestly encounter their own mortality, to both die better and live more fully. Dr. Spiess, we are delighted to have you as a guest on our show.
I'm delighted to be here. Thanks for the invitation.
Of course. So, Dr. Spiess, before we dive into your soon-to-be released book, I'd like to know if you could share with our audience a personal grief experience that perhaps actually led you into your work.
It's probably really more a combination of multiple grief experiences. The friend death was probably an aunt. When I was early college, she and I had developed a real closeness, and she died of advanced breast cancer. And I remember that my uncle, who's a pathologist, had to write pain medicine prescriptions for her because her doctor wouldn't do it. And she died, and I think of her often as someone whose thoughts and my relationship with her do inform the work that I do. Yes. I've used her as an example in several talks, as she taught me much about living well until the end of life. Yeah.
Great. And so would you say that inspired your actually authoring a book? And for our audience, the book is Dying with Ease, a compassionate guide to making wiser end-of-life decisions.
I would say she was one of the first, but that perhaps I didn't know it at the time. What inspired me to write the book was really what Andy pointed out a few minutes ago, and that is years and years of working with seriously ill people. When I was an oncologist, I was surprised at how many oncologists didn't feel comfortable with working with those who their treatment wasn't working anymore. And because I started practice back in the 80s, that was most of everybody. For me, it led me into a deeper relationship with those patients because I got to know them, I got to know their families. I worked for a local volunteer hospice agency early on and met many of them in their homes as they were dying. When I transitioned more into full-time hospice care, I became increasingly aware of how badly these people were failed by the medical community. And I'm not talking about the stuff that we often think about, the ICU stuff, and although they all went through that. The issue was the number of people who had come to my oncology clinic with never hearing the word cancer before, the number of people who came into hospice care who never heard the word dying, death before. I realized more and more that the conversations that happen, those conversations between the doctor, the patient, the family member, that happen all the time, we do that so badly because everybody's afraid of the subject. And I believe that everybody's afraid of the subject because few of us have recognized that we are mortal, that we indeed are dying. I remember a good example, and this is from a great book that I'd recommend to anybody, is Atul Gawadni's book, Being Mortal, when he described his revelation when he realized that the person in front of him that he was caring for was going to die, and that it was okay. It wasn't his fault. But at least in the book, he never took the next step to realize, me too, the one here in the white coat, I'm going to die also. And that's a relationship, that is a point of connection I can make with this patient and understand what this person is going through.
Yeah.
Very powerful.
Yeah.
This, go ahead. A real inspiration also came to mind when I was 20 years ago, probably at a conference, a palliative care conference, and I sat through a presentation by a spiritual care coordinator who has become a good friend of mine, and he led an experiential presentation, placing each person in the audience in the role of the terminally ill person, and then led through a progressive set of losses to eventually losing everything, which of course everyone who dies does. And I found that exercise profound. I've used it and adapted it many times, and I adapted it most recently in chapter 7 in my current book to try, because I think that facing one's dying is way more than getting my advance directives done and getting my estate planning done and making sure that somebody will feed the cat. Facing death means facing and encountering some of the emotion and some of the pain and some of the anger and some of the fear, and doing it when you have the resources to face it so that you're not shocked when it really happens.
So question. I know that Elizabeth Kubler-Ross did extensive research on the dying.
Yeah.
And one of the things that her son had shared with me was that she found that patients that were in their end of life, who were able to have the conversation with those they care about, were less agitated in their death process than those who did have the experience of speaking about their death and their wishes and their life with family members who seem to have had a more peaceful death experience. Can you touch on, is that anything that you can agree or confirm, or what's your experience?
I would say that is consistent with my observations, and I'm intrigued by looking further into that because I am convinced that when you look at what people are afraid of at the end of their lives, what causes agitation? Yes, sometimes it's pain and shortness of breath and things like that. Sometimes it is. I get that. But when those are controlled and there's still something else going on, then it's clearly either interpersonal or relational or spiritual, and that a lot of times that is healed by healing of relationships, either healing a relationship with oneself, healing a relationship with another family member or a friend or an estranged son, or healing a relationship between oneself and the transcendental or the ultimate. So I think that healing the relationships or encountering those relationships that also leaves a legacy, because that person now has something else that's a piece of you to carry forward. Yeah.
Yeah. I was going to comment the experiential exercise that you're talking about. I used for years and have used. I actually used to lecture to an undergraduate lifespan development course local where I am, and I would actually take the students through that, because it really did show. What I found, I think, profound about it myself was that it demonstrated that, you know, the journey toward the end of one's life, and the idea of the losses that we experience along the way, and how that is a process, and what that really looks like for people, and then indeed getting people to think about the fact that one day you're going to die. One of my favorite theologians, Frederick Buechner, I think he wrote in one of his books that if he doesn't think about or isn't reminded of the fact that he's going to die at least once a week, he's not sure that he's fully living. And I always stuck with me that idea of very much what you're talking about is how do we and how can we engage people in this, especially in a society where we so often we don't want to think about it for ourselves.
We don't want to think about it, right? Yeah. Yes, I don't know how we engage the society, and the society is getting less and less engaged as it is. When, you know, we all remember the death panel argument back X years ago, and how much damage that did to that societal conversation and engagement. But I think I do know how to engage individuals, and I think that's how one can do it. I appreciate you mentioning the exercise, because I tried to make it clear it's no way original. But what it was difficult was changing the experience of me as a presenter, because whenever I did this talk, either with a small group or a larger group, I was in relationship with that group, and I could see what was happening and go on. To write it down and figure out a way to communicate that relationship in a way on the page, that was a bit of a job. So let me know if you think it came out okay.
Well, I'm actually looking forward to looking at that, because you're right. It is, and it's interesting. It's difficult sometimes to translate those types of things, an experiential thing like that, into words or written word as opposed to spoken. So but I definitely look forward to that, and look forward to reading your book as well. So.
Okay, great.
And your book is coming out, I believe, next month.
Right. October 20th is launch date. It's pre-orderable. Pick a bookseller. The one around the corner is best, but if you got to use the big boys, it's available. Okay.
Great. Thank you. Andy?
So I had one more comment just about this particular topic. And it's interesting to me, okay, so a lot of people maybe don't acknowledge their own death, but what has always been interesting to me, and I'm curious about your thoughts on this, is as far as our entertainment goes, the subject of fictional literature, the subject of many fictional movies even, and movie scripts, and death and dying seems to always be, if not a central theme, a large theme in a number of the really well-received films, right? Right. And so it's interesting to me that we entertain ourselves with these notions. We feel sad when our favorite character dies on a show. Right. Disney, every one of their main characters are bereaved. All of them. They start the story a bereaved person. So I've never quite been able to fully make sense of that. I've looked at it as I don't think it's that we're death denying. I think that we're afraid of death. Yes. But we're also intrigued by it somehow. Right. I don't know. So
No, I think you're right. I think that gets to the fact that we really want to have that encounter, but
yeah,
we're afraid of what it's going to look like.
yeah,
Yes, but I don't have any major sum up thing or any major wisdom, but I've tried to condense the message of, since I am alive, I will die.
mm,
Since I am alive, I can affect what my dying will be like and live more fully until then. And that's the gift that I hope that people will recognize.
yeah. Well, I appreciate it, and I know so many out there will probably appreciate that as well. I know in my own life, when my mother was dying from cancer, I had a conversation with the oncologist, and he said one thing in the room with her, and when he walked out of the room, said something completely different to me and my family. And I said, well, don't you think that she needs to know this?
She might want to know about this.
And here's what he said is, he said, well, then you'll have to tell her. He said, because I don't want to take her hope away. And that was it. Somehow he had, encompassed that hope was that she would think that she would get more years, as opposed to being able to understand the truth and be able to live fully with the time that she had.
Right.
Found that interesting.
Yes.
Interesting. And it's interesting that that's kind of not even taught in school.
It's getting there. It is getting there. When I spent in my little academic interregnum, that was one of my jobs, was to teach, or at least teach the technique. That's one of the approaches that has been taken, is to teach docs the technique as a procedure, because docs learn things. This is how you do a spinal tap. This is how you do this. Well, teach the procedure. This is how you have the conversation. And part of that's the difficulty, is the emotional piece. Part of the piece of having that conversation is preparing oneself ahead of time, and then also being ready for the emotion when it happens and being okay with that. And that's a tough part.
Yeah, it's not only the emotion of the patient, but it's the emotion of the family.
It is. And sometimes it's wicked, and it's unpredictable. You never know what you're going to get. But that's what, for me, made it fun.
Yeah.
Right. And it's what makes what we do real as well.
Right.
We're shared experience. We're all in this.
We're all in this together here.
Together,
Yes.
Right.
I like it.
Yeah.
Yeah, I agree. Well, Dr. Spiess, we only have a few minutes left.
Okay.
Quite often, people who are watching these episodes want to know how they can further connect with our guests. And
Sure.
I wonder, how would people connect with you, with your work, with your book? How might they do that?
So I think the easiest one-stop stopping would be the website. It's drjeffspiess.com. That includes links to the book, my blog, other comments. There's also links to my Facebook page and LinkedIn page. So that would probably be the one-stop shop for someone interested. Yeah.
Great. Well, Doctor, again, we truly want to thank you for being a guest here at Let's Talk Death, and for sharing your personal journey and the story behind your work and your book. Thank you so much.
Thank you for having me. Thanks.
Yeah, thank you. And thank you to all those who joined us for this episode of Let's Talk Death. If you would like to learn more about Heal Grief, please visit us at healgrief.org. At healgrief.org, you can learn more about all of the programs and resources of Heal Grief, including our national network of support for grieving young adults called Actively Moving Forward.
Make sure to sign up on healgrief.org to receive our newsletter for links for future episodes of Let's Talk Death.
And so again, with that, thank you for joining us, and we'll see you next time on Let's Talk Death.